Are you ready?
Ready. Good morning, everyone, and welcome to our weekly live question and answer series where I sit with Dr. Ellithorpe and we look to answer your questions, which you can post over in the question section over here on YouTube, the chat area that should be on the side of your screen. You do need to be logged into YouTube to do that. You can also email your questions into us. That email address is office@tlcdoctors.com. Just put something in the subject for Q&A, question for YouTube, and that'll be sure to be sent our way. How are you doing today, Doctor?
I'm blessed, thank you.
I am as well, too. And I see we already have some questions pouring in here, so shall we just jump right into it?
Yes.
Okay. First question is from Amela, and Amela asks, "Hi, Dr. E, what's the best approach to heal from a pulled back injury? It still hurts to get up. Should I force myself to be on my feet to heal faster or take it easy?"
Hi, Amela. Yes, I think I know who you are, but I'm not sure. So it's age dependent. If you are in general good health and this, depending on how long ago this happened, if it's acute and such, what I would suggest is most back pain is self-limiting and will self-heal. That's what we have found over the years. Many back surgeries have been done too excessively, and if people would just drink enough water, take some stuff, and if you take a wrap, there's a Velcro thing that, like a big wide belt you can put around your abdomen that helps support your core, and it indicates that you need to be active with exercise, stretching, and some core exercises. So as we age, we tend to put aside the need for exercise and movement, and yet that's one of the pillars, foundations of health. So you have to do some form of stretching, some form of core exercises, sit-ups or crunches or something, and some form of resistance aerobic training. The suggestion is 30 minutes 5 times a week is what is considered what's necessary. I do Pilates, that gets in my stretching and my resistance, and I have kickboxing as well, and then I have my walk. So I'm trying very hard to keep myself in that range so I never get sick, I never miss work or any of our videos. I take the enzymes, the VitalZyme is what I use 5 twice a day. As I'm almost 70, I'm able to do tremendous amounts of work, getting up the Christmas decorations, putting up the tree, cleaning up the garage. When you take things out of the attic and the garage, you suddenly see the garage needs attendance, and cleaning up the house and moving furniture. All these things could aggravate me, so you have to work on that. So my suggestion is, yes, stretch, yes, get those at the drugstore, a little Velcro wrap for around your abdomen, and start getting in 30 minutes 5 times a week of some crunching, some aerobics, some resistance training.
And then as far as supplementation goes, naturally, can't we take something like magnesium, either orally, to help relax those muscles, and of course we have some magnesium IVs as well too.
Right, yes, those are muscle relaxers, right, and that certainly does help. So stay hydrated, be very well hydrated if you've acutely injured yourself. I cut my thumb terribly yesterday, broke a glass in my hand, and it really sliced into my thumb, so you got to take care of yourself.
That's true. Okay, we have a question here from Elizabeth, and she asks, how many milligrams of vitamin C is in the IV drip that you offer? Also, will you ever put more of the doctor's bars in a box?
Oh, well, interesting question. So if you're a walk-in and not a patient here, they can walk in and get a 12.5 gram of vitamin C, which is a high-dose intravenous vitamin C.
Which is, in terms of milligrams, she asked, that's 12,500 milligrams of vitamin C intravenously.
Yeah, 12,500.
Without a prescription.
Right. Now, of course, the nurse is instructed to take a little history and examine you, and then we sign off on that. But if you're a patient here, you can get a 25 gram or 25,000 milligram, 50 gram, 50,000, 75 grams, 75,000, 100 gram, 100,000 milligrams.
Right.
And That's what I. And what was the other question?
Will you ever put more bars in,
Oh.
in a box? Probably not. 12 per box fits. You can always get more than one box.
Yeah, you can buy a case at a discount, I think, and that's got, I think, 12 boxes in the case.
Okay.
So
All right.
I'm glad to hear you're using the bar.
We have a question from Deborah, and she asks, my friend does not have a doctor that prescribes ivermectin. What supplements and plan would you advise for COVID-19 flu illness, young parents and young children who are now experiencing fatigue?
Well, there is the Frontline Doctors, FLCCC.org. There is the Association of American Physicians and Surgeons.com. And they have physicians online in all 50 states that are willing to do a telehealth, that kind of a thing. So depending on where you're located, if you're nearby here, you can come here.
Right.
If we have an opening. And I would recommend you go to those sites and talk to those doctors. I would do early treatment. I would use vitamin D. I've had my patients on vitamin D for decades, decades, and decades. That's why my patients are so healthy, and we had no issue with COVID. We had no hospitalizations or deaths. So prevention is the right thing. So quercetin is something that I use. It's a natural herb. I've been using about 800 milligrams as an antihistamine for my allergies, but it is also a great ionophore that prevents viral illnesses, and it allows zinc to get through the membrane, like macrolides such as erythromycin, azithromycin. Like hydroxychloroquine and ivermectin. Those are ionophores that help get zinc in. When you get zinc intracellularly, it inhibits RNA replicase enzymes, so it stops viral replication. So I've had all my patients on a multi-mineral vitamin supplement that has a base zinc amount, and all my patients did well on a standard dose. Now, if you're jumping in and you haven't been taking good care of yourself or preventatively, you might need a higher dose of zinc for a season. Maybe for a month, get a 25 milligram a day. Children, anyone who's 85 pounds and higher, I treat as an adult. If they're children, you can talk with your pediatrician, but I think it would be very safe to get a children's multivitamin mineral and use it over the counter along with a natural herbal quercetin as an antiviral. Again, try and get either ivermectin or hydroxychloroquine, either as an appointment here or with one of the FLCC doctors or the American Association of Physicians and Surgeons. And then I would be on vitamin D. I think children are really at no risk. They have a 99.998 risk, so they will probably fly through this. But if you're an adult, you probably need vitamin D. I would still give your children some liquid vitamin D. If they're a toddler, 1,000 international units a day. If they're grammar school age, I would give them between 2,000 to 3,000 international units a day. If they're an adult, I would give them 5,000 international units a day. And if they're overweight, they need more, because the more you're overweight, the more your need for vitamin D is. So I take 10,000 international units a day. I've never had a problem over many, many decades, hovering between 10 and 20,000 a day. So that would cover your zinc, your vitamin D,
Quercetin.
the quercetin, resources for prescription, and I would take a anti-inflammatory like Vitalzyme again, or Vascuzyme, or Proteozyme. These are systemic enzymes that prevent inflammation, prevent microclotting. We also have the high-dose vitamin C intravenous, but we also would recommend you use oral vitamin C anywhere between 1,000 to 4,000 milligrams a day, 1 gram to 4 gram a day. We have that as powdered. We have it as the capsules, but you could get that over the counter. Drink plenty of fluids and be low carb, because the number one immune suppressant is sugar, starch, bread, pasta, cereal, crackers, bagels, you know, all these Halloween candies, stupid sugar eating. And so the #1 immune suppressant is sugar, starch, and too much fruit sugar. Orange juice, apple juice, this is too full of sugar. So not to mention soda pops or anything like that. So be very cautious of those things and eat the healthier non-processed foods. And that's how I would approach it.
And I'll just mention, if you are a patient here, you have access to our formulary, one of which is TLC Immune Protect.
Yes, that's right.
And you designed that with your physicians, where you combined all of these elements, quercetin, zinc, and then vitamin C with many, many other things like some mushrooms and other things known to enhance the immune system, modulate it. And it has everything in there except for the vitamin D, because vitamin D is so variable patient to patient.
Right.
Some people will take 5,000, some people will go up to 50,000 for a couple days in a row. So that is a great all-in-one. If you have a friend or a family member that you're concerned about their health, or they're concerned about COVID, I would certainly put that in their hands and then tell them to add vitamin D to it.
Yes, yeah. They don't have to be a patient here to get that.
Right.
Immune Protect is powerful, and it's what we've been using for decades here.
All right, the next question comes to us from Lee, and she says, if you're allergic to soy, what is the alternative for NT factor, which is made from soy?
Well, it is the phospholipid from soy, so you're not getting the soy lectins. So it's like saying you're maybe allergic to citrus, but you're not allergic to vitamin C. Do you see the difference I'm putting there? So to say we extract phospholipids from a product does not mean that you would have necessarily a problem. Then there's also immunoglobulin G, food sensitivities, versus immunoglobulin E, which are immediate anaphylactoid. Now that you would have to be very careful with. But for the most part, these sensitivities are generated from aging, damages of the gastrointestinal system, in which your body develops these food sensitivities, so it's not a true allergy. The phospholipids are critical to your health and are anti-inflammatory because they repair the cell membrane. That's what we're published in. So I don't know that I would worry about that.
Okay, good answer, good question. Another question from Deborah. She says, just so you know that I have been getting many compliments from people that I have shared these YouTube videos. They've mentioned you're a blessing of knowledge and are so thankful. So
well, thank you. We praise the Lord for that. You know, He's the one to get the glory. The day we take glory is the day God will take His hands off of us and not protect us.
Okay, we have another question from Debbie S., and they get lost with food.
Well, there are fat-soluble vitamins that are better to be taken with food. Now, that's not 100% ironclad, but that you get greater absorption if you take it with food. So that would be, and I should make a correction on Monday night's one. We were talking about CoQ10, and I didn't identify that as a fat-soluble vitamin. It is. So CoQ10, ubiquinone, vitamin E, or the tocopherols, vitamin D is a fat-soluble, and vitamin A. So yes,
and
it would.
Vitamin K. Did you say K?
Yeah, K also. So I would encourage you to try and take these after your dinners in the evening. So I take a lot. So I split them. I have my mornings, which are basically my Juice Plus, my B vitamin. I do take my D in the morning on an empty stomach, even though it's a fat soluble, and my levels are very good. And my enzymes and my thyroid and my hormones. And I think
and let me just, I think simplicity, keep it simple, right?
Yes, keep it simple.
I think it's more important to take them
consistent
than to worry about when to take them. Now, the only exception to that would be the ones that really shouldn't be taken with food, like a systemic enzyme.
Correct.
But everything else, I try to encourage people, don't worry, should I take it with food, should I not? Just take it.
Yeah.
Just take it.
And then the digestive enzymes, orthodigestzyme, are to help you digest your food when you eat. So that would be the two critical digestive enzymes after you've eaten, and the systemic enzyme on an empty stomach before you've eaten, for at least wait an hour minimally, if not 2 or 3 That's why I skip breakfasts all the time. So I'm doing intermittent fasting. So when I take my enzymes in the morning, my stomach is empty until 1, and sometimes I miss lunch, okay? And then I eat by 6 o'clock at night. So when I take my evenings, it's around 9:30 when I'm taking my evening one. So my stomach should be empty.
Okay. Shamsa asks, Doctor, what would you suggest for chronic inflammation, constant infections resulting in hospitalization? I have possible chest scarring, but also autoimmune disease, and then Sjögren's causing salivary gland infections.
Oh, Sjögren's. Sjögren's. Okay. That's a autoimmune phenomena. You need to do everything that we teach you. You have to drink a lot of water. You have to take half your weight in pounds as ounces every day. You have to learn what your autoimmune triggers are, and very often it's the gut that is the triggering thing. We need to know your blood type. Blood type A tends to have a lot of these problems. Blood type O tends to be triggered by the genetically modified wheat and dairy homogenization, pasteurization. So that will inflame your gut, which will create this breach that your immune system will respond to. And in some people, it'll be psoriasis. In some people, it will be rheumatitis, rheumatoid arthritis. In some people, it'll be a neurological problem like MS. In some people, it will be Sjögren's syndrome, okay? So these things we feel are largely linked to this injury that's taking place because of the corruption of the food systems, like Monsanto, glyphosates, genetic modification, homogenization, pasteurization, and stress. The more stress we have, the more high sugars stress your system, the fast eating stresses your system, the electromagnetic energy stresses your system. So we would screen that with you. We would encourage you to take something that is reparative, which is a single menu day where you have your meat and vegetable day for lunch and dinner, have your stomach empty 18 hours to increase the healing time, a chicken and vegetable day in which you have lunch and dinner, and so you have 18 hours. Notice we're skipping breakfast. So your chicken vegetable, your fish vegetable, your pork vegetable, then come back to your beef and have that for both lunch and dinner. So your immune system is getting a break from all the chemicals and fast food and ingredients and so forth. Then we can give you phospholipids, although they're rich in the meat, the fish, the turkey, the chicken, the eggs, and they frightened our corrupt system, our corrupt medical system frightened us from eating the fats and the egg yolks for 50 years. So we have a lot of holes and patches in our cell membranes. Then EDTA chelation is tremendously helpful for Sjögren's syndrome because it helps the microcirculation get to their deeper tissues, and they don't get so much fibrosis and scarring down and problems. Plus, we enhance it with vitamin C and minerals and zinc. So our Sjögren's patients, our MS patients, our autoimmune patients really either improve or don't progress. They
Great.
just don't. Praise God.
Debbie S. asks, does microwaving kill all the nutrients in food?
My answer is yes. I don't have a microwave. I will not have a microwave. That is creating tiny electromagnetic waves that make and synchronize with the water molecule, the H2O, and that makes that vibration so violent it creates massive biochemical bonding disruptions. So if you're known as, if I were to cut off my arm and my hand, okay, am I the same person? Yeah, I am the same person, but I can't do what I was supposed to do. So if my job was to do a good job doing something with that hand and this arm, I can't anymore. So if you break up by energizing water molecules, the essential fats, the proteins, the amino acids, and so forth, you have destroyed the food value.
Okay, good simple answer there. Try to avoid microwaves. Hi, Dr. Althorpe. My family and friends got COVID gene therapy vaccine. Is there anything they can do to detox from it?
Yes, they can take systemic enzymes. I would say about 15% of my patients took the vaccinations, and their risk for microclot, inflammatory, inflammothrombotic events is mitigated when you take systemic enzymes, morning and evening, when you drink enough water, when you reduce the sugar, starch, fruit sugar in your diet so you don't make sticky, blood clotty prone passages in your tiny capillaries. It is also helpful to take EDTA chelation IVs, which improves microcirculation. They can check out the trial to assess chelation therapy done by the NIH and published in 2012 by Cedars-Sinai research. There were thousands of people involved in that, blinded, controlled, and they did very well, and they were so impressed with the results on the circulation that they did this tech trial 2 to actually understand just how does this work. And it really does it by reducing oxidative stress from the heavy metal burden we bioaccumulate. And of course, China is dumping all this coal power plant soot in the air. They're not under restrictions like we are. And that dumps these heavy metals on our land in the jet stream. Fukushima sent the uranium, and I saw from March of 2011 to June of 2011, all my patients started releasing uranium. So this microcirculation would be a help to people who've had the vaccination. And then repairing and eating your food such that you understand your bilipid membrane of your cell membranes need the fat. Mm-hmm. They need the phospholipids. They need the egg yolk. And then we would certainly encourage them to take other measures to determine how to preserve their health. A-type blood is at higher risk. And there's a whole story as to why A's as a class don't digest as well. They have poor digestive enzymes from birth.
Right.
And then the elderly become more like A-type blood because we all have less digestive enzymes and enzymes as we age. So if you're replacing these enzymes, then I think you're going to mitigate a lot of this problem.
Okay, a few minutes left for a couple questions. We have another question that says, for supplements that you recommend, what should we look for in a brand and what dosage should be taken? Well, I think you're referring back to what to take to boost your immune system, to prevent or help you recover from COVID. And that is something that our doctors created together, and that is called Immune Protect. That's available through us. But outside of that, we will only work with companies that we have gone out to visit their manufacturing facilities. We've talked to them about where they get their raw materials, how they test their raw materials. We've met the owners of the company or the board, because unfortunately in the supplement industry, it's very easy to come to market with a product and then cite other studies about the effectiveness of one of your ingredients, but your product has not been tested.
It's never been tested. Yeah.
But if I were to name a few brands, Orthomolecular Products is one that we really, really like. You do need to get that through a healthcare professional, so that you can't find that at GNC. Who else? Zymogen is a reputable company. Metagenics is a reputable company. Designs for Health, Apex Energetics. Those are the ones that are coming to my mind.
Juice Plus.
Juice Plus. Oh yes, yeah. Juice Plus. Everybody can get on Juice Plus and take that, and that is a great baseline one. But it is hard if you're just walking into a health food store to know what to look for and what's quality.
So look at my whole practice. My father was in food research. I was a chemist before I became a doctor. Mm-hmm. And I have been seeing patients for 40 years, and they're all coming to me with bags of supplements and all kinds, all the names, and I'm not going to say a name on here, but they're all there. And I'm doing assays and tests on them, and their levels are lousy.
And yet they're taking all of these vitamins.
And yet they're taking all these over-the-counter prescriptions. So I don't chase after whatever people are purchasing over-the-counter because there's no control. There's no reproducible assays. So I have to have a tiny formulary here of proven, assayed, clinically tested material. And that's just the way it is. Mm-hmm.
So I would recommend, if you're not local to us and you don't have access to us, find a functional medicine doctor, integrative medicine clinic or center that you can go to, because they're going to establish relationships with these good, reputable supplement companies, and they'll be able to get you access to their line of professional through a doctor only.
They could go to acam.org.
Yes.
And that is the American College for the Advancement of Medicine. That teaches, for instance, chelation therapy since the 1960s. They have a search, find a doctor near me. At least if they have gone for training in chelation therapy, they're likely to be open-minded to the value of nutraceutical support.
Okay, to wrap up here, we have a question. My adult daughter needs to take a COVID test before her office Christmas party. Is it safe? Or is it planting something up your nose into your brain, as the horror stories I've heard? So a COVID test.
Yeah, well, you know that even Fauci himself, in a July 16, 2020 interview in Virology Today, declared that the PCR testing for the value of predictivity of infection with this COVID-19 SARS-CoV-2 virus is useless, because the cycle thresholds that they're using are 35 and higher. And there is no predictivity. They're all false positives, or the vast majority. And they admitted it. He admitted it. Why are we still using this? So why would you use a test?
Well, if you're required to, let's say you're going on a trip or you're going to an event and you've
I wouldn't let anybody stick anything up any orifice of my body.
Okay.
You can spit and give them a test, you know, but I just was watching someone who did that over-the-counter test and used water droplets, and the water was positive. And you know that Nigerian or some African president tested a sheep and a fruit, and they were positive. So excuse me, there is too much unknown here. There are too much conflicting statements. Where's the safety data? Where's the weekly pronouncement of what they're finding and their surveys and their assays? No, and then the whole test is going to be disregarded on the 31st of December. So why should I put any value in that?
Okay. Well, that's it for all of our time for questions today. Dr. Ellithorpe will be back here on Monday.
I didn't get to any of mine.
You didn't? No.
But
Dr. Ellithorpe has
Monday.
a longer session on Mondays. It tends to be longer. That's at 6 p.m. Pacific time. And she's on her own, so I'm not here to slow her down. You can ask your questions there, and she'll answer them. Otherwise, we'll see you back here next Wednesday at 9:45 a.m. Pacific. We look forward to seeing you then. Until then, everybody, be well.
God bless. Bye-bye.
Bye.